Hello. Today I thought it would be a good idea to kind of give you a backstory of my pregnancy and the birth of CJ. I had a pretty typical standard pregnancy, no issues, no complications. We did the AFP test, which is a test done in pregnancy that helps to indicate whether your child will be born with something like Down syndrome, and our AFP test results came back normal. So we thought we had passed that hurdle of Down syndrome. One day I was in my apartment and I just noticed that the baby wasn't moving quite as much as usual. Typically, CJ would move a lot in the belly, and so I thought something was a little odd. So I just laid around at the time, and I was married at the time to CJ's dad, and he was at work. And so I just laid around to see what would happen, and the baby just wasn't moving. So I called my mother-in-law, I called my mother, got some advice, and then so they told me to call labor and delivery. So I called the nurses at labor and delivery, and they told me to drink some juice or eat something sweet and see if that would trigger the baby to move. So I did that, and I waited around for quite some time and still no movement. So I became very worried. I was about 37 and a half or 38 and a half weeks pregnant at the time. So once my husband at the time came home, I told him immediately that we needed to go to the hospital. So we took all kind of back streets. He was speeding through the street just to get us to the hospital, and we got there in, ample time. So they rushed us in. They hooked me up to monitors, and, we didn't think anything of it. But as they hooked me up to the monitor, and I say it wasn't even 5 minutes, they came in and said, hey, is the monitor, did it fall off your stomach or anything? Because we're not, nothing's registering on the heart rate and things like that. And the monitor was on me, So that told them that something critical was happening. So before I knew it, before I could say anything, the doctor was there, and she told me, okay, you know what? We're going to do a C-section. So they're prepping, doing all the necessary prep work. I signed paperwork. And in the midst of me signing the authorization for the C-section, all of a sudden it turned into, this is going to be an emergency C-section. So paperwork switched over, had to sign something else, and everything went like a whirlwind. They removed my husband from the room, and before you know it, I was in the operating room, and I was getting ready to deliver my baby. So in the meantime, I guess my husband was able to call my mom and let her know. And so everyone rushed to the hospital. And, luckily he was able to join me eventually in the operating room, and we gave birth to CJ. As they took CJ out, I looked over to my right, and I could see him on the table, but I knew he wasn't moving, he wasn't breathing. So at that time, they were working on him to get him breathing, and the doctor came over to me and said, ma'am, your son is not breathing, we have to, work with him, and on top of that, he has, at the time they used the word mongoloid, so he has mongoloid features, so we believe he has Down syndrome. And we'll get on the subject of the terminology you use and the use of mongoloid, okay? But, my role stopped. I had no clue. We didn't know anything was going to be awry as far as CJ's health. You really, at that time, are in shock. You don't even have any feelings at that time because you're just in utter shock. So they rushed him off. And my mom told me that when she came to the hospital, she saw, doctors rushing and saw a guy in scrubs, but he had the mask on, and she couldn't tell who it was. And she was just thinking, Lord, please don't let that be my baby, my grandson. But sure enough, it was. She didn't know at the time, but that was CJ that was being rushed off. So that's a little backstory to the birth of CJ. Like I said, we had no forewarning. That day of his birth was just mind-blowing. We didn't know what to think. When I woke up, and I saw my mom there with me. I saw my aunt there with me. And I was shaking because the effects of the anesthesia. That's the day that my life changed. And, during the course of my hospital stay, of course, I was recovering from a C-section, was already horrific in itself. But never in a million years would you think that you would have a child and you not be able to have that baby in the room with you, And so at the time, I stayed in the hospital for a few days, and you can hear the moms and their babies crying in the rooms next to me. Yet, I still hadn't seen my son. I was unable to go see him. And so I had a cousin who went to go see him, and she took a picture of him. And they came back and showed me the picture of him. And, it blew my mind. My baby, you could tell just something was not right. He was really swollen, had a lot of fluid that he took in when he was in the womb. So it was just not the experience that you anticipate. So it took a couple of days until I was able to go see him. We had social workers come into the room, people trying to assess me to see if everything was okay. And excuse Chubba, he's in the background. That's my other son. He's in the background crying for mommy. But, it took a couple of days before I could see him. And we had the social workers coming, making sure I was okay. Because really, I was just in shock. They probably were amazed at the lack of emotion because I didn't know what to think. I had never done research on Down syndrome. I didn't know much about it. I've only seen certain people. Hold on one second. Come on. Okay, here's Chubba. So I didn't know much about Down syndrome. So it was really a shock to me. I was, mind you, I think I was around 22 or 23 at the time when I had CJ. Hold on. And so, I was young. And so not the typical age that a mom would be when they have a child with Down syndrome. Usually you think of 35 and up. But I was a young mother, so, it was a shock even to the doctors. And I had no family history of anyone in my family with Down syndrome. Therefore, it was just a really, really, really trying time, to say the least. So that's the backstory of me being pregnant with CJ, giving birth to CJ. And in less than an hour, we're going to feeding therapy. So I'm going to come back and let you know how that went and give you the story about the feeding issues we've experienced as well with CJ. See you next time. Bye. Say bye, Chubba. Say bye. Bye. Bye.